What are some of the things that we should not do if we have an ear infection?
Well, one of the things we touched on was sticking things in your ear. So I would avoid doing that, like Q-tips and things like that. I wouldn't put anything too far in there, and things like hot oil and things like that. I would avoid things like that.
Okay.
Now, one other thing that I just wanted to mention is for ear infections, a lot of them, they can get better with time on their own. And the American Academy of Pediatrics actually recommends in some kids just doing observation. So in some kids, if it's a mild ear infection, they don't have very high fever if it's less than 102, and they're a little bit older, like over the age of 6 months, then they recommend watchful waiting for like 48 hours to see if they get better on their own. And if they don't get better, then you can put them on antibiotics.
Okay.
So it's a common practice here in this country. We usually treat all ear infections with antibiotics. But there are some new recommendations there about not putting them on antibiotics right off the bat and giving them time, giving them a couple of days and observing and having close follow-up and see if they get better on their own.
Now, I remember when my son was a wee little baby many years ago, like he would have an ear infection, get over it, have the antibiotics, and 2 weeks later he'd be back with another ear infection. So do you put him back on antibiotics? Do you put the child back on antibiotics in that case?
Yeah, if it's a ear infection and they have the common symptoms like the fluid and they're having lots of ear pain, fevers, then yes, you would treat it again. And that happens pretty commonly. Really? Yeah, where kids have ear infections again. So there's some kids who are just prone to getting ear infections, and they can get them a lot. They can have several, in a span of a few weeks or a few months.
Okay.